He is not, he is already here with me, and he's a medical doctor. So we'll be doing this together. And as you know, stroke is a disease that can affect anybody. So now, are you or any member of your family suffering from stroke? Do you, like me, see stroke as a sickness meant for the elderly? Are you also aware that people from age 30 plus are also having stroke? And you're worried about these developments? Do you have knowledge of the available treatment options? Or do you know what you can do to help yourself and your loved ones from having stroke? Well, on Health Talk with Vivi this morning, we'll be discussing everything stroke, and Dr. Victor is already here. Good morning, Dr. Victor.
Good morning.
You're welcome to the studio.
Thank you very much.
All right, let us immediately begin. And to begin, I'd like to ask, what is stroke?
Okay, thank you for the opportunity for joining you this morning.
You're welcome.
So, we should all understand that stroke is usually a vascular event, and there are symptoms that usually evolve rapidly due to cerebral dysfunction. So, as I said, it's a vascular event. That means the blood vessels that carries blood to various parts of the brain might be blocked or they might rupture. And following this event, symptoms manifest such as weakness of a particular part of the body or deviation of the mouth to a particular side that is stronger than the other side. So, as a form of definition, it is a vascular event, and symptoms usually evolve within hours of cerebral dysfunction.
All right, thank you very much. There's this notion we normally hear. Some people say when you have stroke, when it affects your right hand, it is serious. When it affects your left, it's not serious. I don't really know, but I want to ask: are there types of stroke?
Yes, there are types of strokes. As I said, it is a vascular event. So, in the vessel, it's either there is a blockage, thereby which there is a blockage, the distal part of the brain does not receive nutrients and blood. And the other type is the rupturing type. So there is the ischemic type and there is the hemorrhagic type. So the ischemic type is the blockage type, where the blood vessels which are narrow in the brain, there is a clot formation that stops or impedes the flow of blood to other part of the brain. And the other type is the hemorrhagic type, whereby the blood vessels ruptures and there is bleeding into that part of the brain. Two of them will manifest almost similarly, but there are ways to differentiate them clinically.
All right, because I have a family member who suffered from so, and the doctor was like telling us go for brain scan and all of that
Yes,
to check
yes,
if there's bleeding. Obviously,
yes,
talking about what you just
yes,
said.
yes, yes, yes.
All right, all right. What actually causes stroke? Does it just come on its own, or are there things that can cause stroke?
There are risk factors for stroke. There has been established factors for stroke, and there has been classified into modifiable and the non-modifiable risk factors. So the non-modifiable risk factors, there are really nothing you can do about them. That's one is increasing age. So as someone grows older, the risk increases for development of stroke. Then gender-wise, it's commoner in males, but at the particular age at menopause, the ratio becomes equal. Then
Okay.
black race also have been seen to have higher propensity to develop stroke. Then there are also some family history. There are some genetic disorders that runs in some family that predisposes them to having stroke. So then for the modifiable risk factors, which that's what we are here for, that you can do something about. So top on the list, we have hypertension, that's poorly controlled, persistently high blood pressure, diabetes in our environment, people that take alcohol, people that smoke. When people talk about cholesterol, when the cholesterol level in the blood is high, it can also lead to stroke. Also, sometimes people that have genotype SS, they also at risk of having stroke. People that from that suffer insect bites, which will cause clotting and so clotting of blood in the whole system. So those are some of the risk factors for stroke. There are others, but commonly seen in our environment: hypertension, diabetes, alcohol consumption, increased cholesterol in the body, genotype being SS, and others.
Okay, talking about increased cholesterol in the body or in the blood rather,
Yeah.
are there ways to identify or to know that you have these things, or must you go for a test? Because unlike others that exhibit symptoms.
Yeah. for the cholesterol part, you most times you have to check, but there are some signs. Looking at the person's face, you can see some form of fatty deposition or
Okay.
whitish plaque around the eyes,
Okay.
and those that are on the big side, most of the time they tend to have um, high cholesterol. If your BMI is more than 30, it's also significant.
So one needs to watch his or her weight.
You watch your weight, watch your diet, then go for routine checkups.
Okay, we'll still get back to that when we
Yeah.
talk about preventive measures.
Okay.
All right. Before now, I used to think that stroke is just for the elderly because my grandmother has it. Okay. So, but recently, I used to see people 30 plus, 40 having stroke. Why is that so?
Yeah, thank you for the question. Due to westernization, people have started adopting the lifestyle of the developed countries. So we start eating food like junks, and more these days people are more of sedentary lifestyle, and now young people smoke more than before. Then we've also seen that, as I said, the people that have the genotype of SS, they tend to be prone to having that. Then these days we've been seeing diabetes in the young, we've been seeing
Exactly.
people having hypertension in the young, and these are known risk factors for stroke. So because these things are more diagnosed and are coming up in the young people, these tend to be more common, as in people of the young age group now develop stroke.
All right. Thank you very much, Dr. Victor. But before we continue, let's go on a short break. We'll be right back.
No one can stop my shine, no. Raro, raro, raro. It's your favorite girl, YJ, and you're listening to the Voice of the People 90.3 FM.
Yes, so my name now, Mr. Ron, and you're listening to Voice of the People 90.3 FM. Here I go.
I am Dr. Bodri Oshikumaya, the Executive Secretary of the Lagos State Blood Transfusion Service. Keep listening to Voice of the People 90.3 FM.
Yes, so my name now, Mr. Ron, and you're listening to Voice of the People 90.3 FM. Here I go. Morning in the back, sell a food bit in the hanky, most popular bank for Nigerian Power Bank. Abia. Mr. Ron, I don't chop food, I don't chop knuckle, I don't wear shoe will be like sandal without buckle. This is the Voice of the People 90.3. They are raw, forget English rap, man, flow for pigeon. Abia.
You are listening to
The number one station.
the Voice of the People 90.3 FM. Do not touch that dial.
This is your number one radio station.
90.3. The one radio you tune in on your way home. This is the one.
BOP 90.3 FM.
Yes, sure. This is DJ Latitude, aka Turn Up Initiator. You are listening to 90.3 FM. 90.3 FM. Voice of the People.
Shake that thing, miss. Can I shake?
Hey, wait, I know I say rock about the 90.3 at the station. Still, we are going to run the city. We are going to run the nation. 90.3. Voice of the people. Okay, at this. Well, you don't know. Tune in to 90.3. Left it alone. Left it alone. Left it alone. Don't touch them dial. Don't.
Take me, want me see you get life on the rhythm.
The Voice of the People 90.3 FM.
Yet you welcome back, and it's Voice of the People 90.3 FM, and it's Health Talk with Baby this morning, and I've been talking with Dr. Victor, who is in the studio doing justice to the topic stroke. All right, welcome back, Dr. Victor.
Thank you very much.
I have another question that I would like to ask. What is the first thing I should do if I think someone is having a stroke?
Okay. First you have to know the symptoms of stroke.
Okay.
So when it happens, some people develop they lose consciousness. So you might not know what is really wrong. You might confuse. It can be confused as some people could start convulsing. But what we see is most people develop one side weakness of one side of the body. Some people their speech might be slurred. Some people they might have transient blindness. So depending on the part of the brain that is affected. So once somebody is suspected to have a stroke, what you should do is better to just bring the person to the hospital. Of course, if the person the symptom is convulsion, we try and push the person to the left lateral position so that the person does not aspirate the tongue or saliva.
How do you push the person? Can you just demonstrate how do you push?
You
the
just
person?
roll the person. Most times they're always on the floor.
Okay.
You try and take away whatever is going to harm the person the more from the environment, and just turn the person to the side and wait for the seizure to
Left
stop.
side.
The left side of the
Okay.
person, yeah. So just wait. The most times the convulsion will stop on its own, but if not, and you're still there for 1 or 2 minutes, it's better to start coming to the hospital so that we can abort. But those that we know that have this kind of condition, some of them used to have anticonvulsant at home. You just put it into their rectum, into their buttocks, anus, or through the mouth. Or some people have been taught how to administer it via IM. But generally, just put the person to the safe side and bring the person to the hospital as quick as possible.
Okay, there's no need pouring water just like so.
No need to pour water, no need to give anything, no need to put onions, no need to dip leg in. No, those are
because in this part of the country we like about treatment so much.
No.
We
There's
like
no
do it yourself.
Yeah,
So
yeah.
Dr. Victor is saying do not do anything yourself. Just put the person in the possible safe side and rush to the hospital. All right, Dr. Victor, what are the available treatment options for stroke?
Okay, the treatment options, and we have to first know the type, because the type determines the treatment.
Okay.
So once the person comes to the hospital, the best thing to do is to go for brain imaging, that is the CT brain, to know the type, so as to initiate treatment as soon as possible. Because there are ways to guess, but the best way to do is to do the imaging. Once it is not hemorrhagic, there are ways to treat. Once it is hemorrhagic, there are ways to treat. So the first thing to do is to go for the brain imaging so as to know the best management plan to follow. And we also need to identify the risk factors in that index patient and start correcting as quickly as possible.
Okay. For some people, I've seen people because seeing stroke patients is very easy because it's
Yes.
almost in every
Yes,
family.
it's-
All right.
yeah.
So I've seen people, they'll have one of their arm or leg will be paralyzed, and at
Yes.
some point the person won't regain that particular side that was paralyzed. So why?
Yeah, because as we've earlier established, the problem is from the brain. So when there is impedance or rupture of the blood vessels in the brain, the parts of the brain that is affected, some of them die off. And if there is no there is delay in presentation to the hospital, that part of the brain that has been affected can widen. That is the dead part of the brain can become wide, and that will delay the rehabilitation process of the person. So the earlier you present, the better the outcome, the better the prognosis. So as soon as the person presents to the hospital, once the CT scan has been done and the type has been established, treatment is commenced and physiotherapy starts immediately so that the person can regain full function as quickly as possible, because it's painful to see those that are even right-handed and they're having stroke in that particular part. And sometimes you might have to change your trade because of the stroke that has occurred. So it's good the person presents early and treatment is commenced promptly.
All right, Dr. Victor, I still want to ask. Some people, we like hearsay a lot,
Yeah.
especially in this part of the world.
Yeah, of
Some
course.
people will tell you that if you've had stroke before and you have it the second time, that you won't survive it. So why will someone who have had stroke the first time have a stroke again? And if yes, why won't the person survive?
Yeah, the mortality rate for repeat stroke is usually higher than the first stroke.
Okay.
Firstly, because the person has suffered an injury, vascular injury in the brain. So imagine it coming again, and depending on the recovery of the person the first time. Some people recover fast. Some people have the stroke even before coming to the hospital. All the symptoms resolve within 24 hours, within hours. So that's like transient ischemic attack. So even if you have that, doesn't still mean that you should not still come to the hospital, because that transient ischemic attack is a risk factor for developing stroke in the future. So let's say a part of the brain is already dead. Now you are having another stroke. So you're having another part of the brain that is going to be dead. So depending on the size of the dead part of the brain the first time, now you are accumulating and adding another one. So the mortality is usually higher. I've seen people that develop stroke twice, thrice, but their lifestyle, the quality of life they live afterward is like nothing. You don't. The caregivers are always frustrated because the person is always dependent on them.
I know how it feels. I've been there.
So that's the way it is. So once it has happened the first time, you keep going for your follow-up visits. Ensure once the risk factor has been established, if it is hypertension, if it is diabetes, take your medications, adhere to the lifestyle modifications, and routinely check your BP and your blood sugar at home, and the risks of having it again will be reduced.
All right. Then talking about preventive measures, because you will not talk about preventive measures without talking about lifestyle modifications.
Yeah.
So now let's go to that lifestyle modifications.
So for people with hypertension, usually we tell them about DASH diet. That's dietary approach to stop hypertension. So what we know is that even those that are newly diagnosed hypertensive, with modifications in their lifestyle, if you stop taking alcohol, if you reduce your salt intake, if you take more fruits and vegetables, if you do more exercise and you sleep well, some of these indices help to reduce blood pressure by a particular amount. So going by lifestyle changes, stop whatever it is that is making the blood pressure to come up, which we've identified as salt is part of them, alcohol is part of them, smoking is part of them. These things tend to make the blood vessels to be stiff. So if the blood vessels are stiff, they don't relax to accommodate the pressure, and that can lead to stroke. Then for diabetes, there are diabetes diet, there are food that are high, that have high glycemic index. So what we recommend is you go for diet that have moderate or low glycemic index. And
what's this glycemic index you give? You know, I'm not a medical doctor, so let me understand. Those listening, let them understand.
Okay. There are some food that have high carbohydrates.
Okay.
Food like rice, food like yam, like gari, like cassava and the products. Then there are some that they still have carbohydrates, but the proportion of carbohydrate in them is lower than others, like beans, like unripe plantain, like wheat, and so on. So those are the kind of diets we recommend for those that are diabetic. Then other risk factors, as I said, like alcohol, you stop them. If you have high cholesterol, you should reduce your intake of oil, cheese, butter, and the likes. And
are there safe oils to use?
You say?
Are there safe oils to use?
Yeah, like olive oil is the safest.
Okay.
To use. Then all those oil that contain omega-3. Coconut oil is good, but olive oil is the safest. Yes. Coconut oil, some people say sunflower oil. So those are the safe oil to use.
All right. I want to ask you the one last question.
Okay.
You know, here in Lagos, or the whole of Yoruba land, we like agbo too much.
Yeah.
And some people like to take agbo will prevent stroke. Please talk about that. Let's know if it actually will prevent stroke or not.
Yes. What we know is there have been studies to show the side effects of medications we use, but I'm not aware of any study about any herbal medications. We are not saying herbal medications are bad, but we don't know the quantity that will not be toxic to the body, especially the liver. And some people just consume they just take it without no prescription. They just take whatever volume they want. They mix anything they mix. But these drugs are gotten from herbs and trees, but they have been seen in the lab. They've been studied in the lab. You will know the dose that will affect the body, but for herbal medications, we can't really say that this amount is what you should take that will not lead to this. So what we just advise is you should stop taking herbal medications because we don't know who is even at risk of developing liver problem later in life. Yes. So all we would advise patients is just stop and stick to your lifestyle modifications and your medications. Yes.
Because another thing is that we don't even know the chemical components. Even those preparing it don't know the chemical components of what they are preparing.
Yes, true. I agree with that. So it's just best to stop. Also, when I go home sometimes, my parents force me, but I just take little portions to just honor them.
Yes.
But I don't take every day, maybe once a week, and I know the portion I take. So it's just to honor them. But those that take every day is not advisable. So all we say is just stop. Especially if you've seen someone that has started developing organ failure. So it's just better to stop and stick to the scientifically proven safe medication.
All right, thank you very much, Dr. Victor. It's been a timely session with you.
Thank you very much.
You have actually given us insight to everything concerning stroke. Thank you so much. We wish to have you some other time. All right, that's how we'll come to the end of our program today. But we have other beautiful programs coming your way. We have Business Roundtable with Peter Anosike and the World News at 12. So stay right back and enjoy all the beautiful things we have in store for you, all for your pleasure. Well, my name is B Blast, also known as BB, and you just listen to Health Talk with BB. Good morning.
No one can stop my shine, no. Rah, rah, rah. It's your favorite girl, YJ, and you're listening to the voice of the